Have you ever gone to your dentist begging for a root canal? I have, at 3 different times. The 3rd time I showed up, my dentist refused to treat me. Instead, she referred me to a neurologist who diagnosed me with trigeminal neuralgia. According to researcher Joanna M. Zarakuski, trigeminal neuralgia is not very well known among the general public or even practitioners. This is probably why it's misdiagnosed so often. Knowing the signs and symptoms of trigeminal neuralgia could help someone receive a timely diagnosis and relief. I'd never heard of trigeminal neuralgia before my own diagnosis, but since then I have done extensive research on the condition. Today I'd like to tell you about what trigeminal neuralgia is, the causes and triggers for the pain, and some of the treatments in the context of past, present, and future. Trigeminal neuralgia is a neurological condition which causes extreme facial pain. Let's begin our examination of this condition with the physiology behind what causes the pain. The Duke University Medical Center explains that trigeminal neuralgia pain stems from damage to the trigeminal neuralgia nerve root at the base of the brain. And the National Institute of Neurological Disorders and Stroke describes the 2 causes of this pain. The first one is compression. When a tumor or an arteriovenous malformation, a tangle of blood vessels and arteries, presses against the vein, it causes compression and causes trigeminal neuralgia. The other cause is erosion of the myelin sheath covering the nerve, which it could be like the insulation on an electrical wire. If this is worn away or eroded, the nerve sends crazy signals from the nerve endings to the brain, causing extreme pain. There are 3 branches of this nerve that reach to the front of the face on each side, and usually 1 or more of these can be affected by the condition, but it's not usually bilateral, thank goodness. To recap, trigeminal neuralgia is caused by 2 types of damage to the trigeminal nerve and causes extreme facial pain. Now that we know how the pain is caused, let's focus on the pain itself. There are 2 types of trigeminal neuralgia pain. The first one is kind of a continuous aching, burning, throbbing pain, and the second is a more acute, stabbing, quick pain. And sufferers can have either of these, or they can have both of them at the same time or intermittently. Sadly, the International Journal of Clinical Practice says that eventually the attacks and the pain will get stronger and closer together. Dr. Wolfgang Littke, a trigeminal neuralgia researcher, says that trigeminal neuralgia pain is some of the most devastating pain that humans can suffer. And the pain is devastating, and the condition is devastating not only because of the pain, but because the triggers are parts of everyday life. Talking, eating, brushing your teeth, kissing, putting on makeup, shaving, the wind on your face, or cold can all trigger attacks. But what is even worse, as Mark Oberman, neurologist, explains, is not just that the pain is debilitating, but even the fear of causing another attack interrupts people's regular lives. Now we know the physiology behind trigeminal neuralgia. We know the triggers and the pain it causes. Sadly, there is no cure for this condition. However, there are viable treatment options. Let's look at these options in light of past, present, and future. In the past, many of the treatments were just plain ineffective, and others were dangerous. The Journal of Neurological Focus explains several of these cures. And just as a forward, analgesics and opioids usually have no effect on trigeminal neuralgia pain, so most things were ineffective. Various chemicals were tried, usually with copious amounts of alcohol. Sometimes opiates were tried too. But some patients got nothing more than laxatives. They thought treatments were effective if blindness occurred, paralysis, or unconsciousness. Basically, if you couldn't feel anything anymore. The side effects were devastating: organ damage, blackouts, paralysis, and even cardiac arrest. Dr. Littke also reported that if there was no other way to find relief, many patients turned to suicide. Today, medications are the first line of defense for treating trigeminal neuralgia. Anticonvulsive and tricycline antidepressants are the medications most often used, but eventually they'll become less effective and then stop working. Then surgery is the next option. The first type of surgery removes the tumor or the compression causing the problem. The second type of surgery puts a spongy cushion in where the myelin sheath used to be. And surgery can be effective for anywhere from 3 to 15 years. However, it can be repeated as long as the candidate is healthy for another surgery. As we have learned, there are also future treatments. Botox and electrical shock treatments are some things being tried and offer some hope of relief. But as we have learned, trigeminal neuralgia is a painful and progressive condition with no cure. With the amount of information that we have just reviewed, I could have avoided 3 long years of pain searching for a diagnosis and treatment. In conclusion, most people are unaware that trigeminal neuralgia even exists, or that it's a painful neurological condition caused by damage to the trigeminal nerve. Maybe someday your knowledge will help someone get the treatment that they need in a timely manner. Perhaps with continued education, trigeminal neuralgia will never again be known as the suicide disease.